chewing gum helps for exercise. Fruits, citrus fruit particularly, apple, oranges, they help to provide exercises to the jaw. So we must be able to counsel our patient so that they can eat right. When your patient eats well, your patient will look healthy. And you cannot counsel your patient to do something and you yourself will not do it. So which means you must practice it too. What you ask a patient to do, you should be able to do it. Very important. Let me show you something again. This one looks a little bit funny. What mouth problem does chemotherapy cause? What mouth problem? You all know what chemotherapy is. Therapeutic treatment for cancer. Do you know that that treatment that they go for that kills that cancer cell also kills part of the tissues of the body? Do you all know that? In our mouth, for example, see, we have a very big role to play as dental hygienists. I must tell you, you can save so many lives by your counseling. If you counsel your patient right, there is no harm, the patient will not run back to your clinic. Because the results will be there. The results are not hidden. If you look at here, it said you may have certain side effects in your mouth from chemotherapy. Another person may have different problems. The problems depend on the chemotherapy drugs and how your body reacts to them. You may have these problems only during treatment or for a short time after treatment ends. What are the results? Look at the results there. Number one, it says painful mouth and gums. Number two, it says dry mouth. These are signs that something is wrong with the mouth, something is wrong with the body. You know, the mouth gives sign when something is wrong with the body. The mouth signals. And once the mouth gives that signal, these signs are bound to be there. Burning, peeling, or swelling tongue, infection, change in taste. Anything you eat at that time, sometimes you say, I don't know why when I eat, the foods that are good, when I eat them now, is bitter in my mouth. It's a signal that something is wrong. It's giving you a sign that something is wrong somewhere. So we need to let our patients know that they must be able to do the right thing. Cancer depends on our hands. If we counsel our patients properly, that cancer cell in their body will disappear. It will not be there. But if we don't counsel our clients or patients well, and they eat anyhow, then these signs that shows here will manifest in their mouth. Let me also show you something before my time runs out. This one talks about us. This one I'm going to show now talks about us. It says, what will the dentist and dental hygienist do? So many times, the public will not define or understand the duties of dental hygienists. Sometimes they don't know. They think it's only the dentist or the periodontist that do everything in the dental clinic. That the dental hygienists have got no role to play. But I want to announce to you today to be proud of your profession. Your profession saves so many lives. I want to announce to you as well to make sure you counsel your patient in the right direction. Remember, the basic thing there are good food. The right food and not the good food. There are the ones that are called the good food and there are the ones that are called the right food. Is there any question? If you have any question, let me know before I round up. In absence of no question, let me just summarize what I have just said. Let me bring it maybe in just a second. Number one thing I want you to know today, that you as a dental hygienist, you have a role to play as a nutritionist or dietitian. That's one. Two, I want you also to know that you can save so many lives through your counseling. Three, I want you also to know that it is necessary to plan your food, embodying all the classes of food I have mentioned. There are 7 I've given you: protein, carbohydrates, fats and lipids, mineral salts, water, and vitamins, and roughage, which I said it is necessary for your digestion. I want you also to know that your job is defined. That's part of your assignment. Check the patient's mouth and teeth, take x-rays, take care of the mouth problem, show you how to take care of your mouth. Show the patient. This is recurring to the patient. Because these are the questions they have been asking. What are the duties of dental hygienist? These are the assignment of the dental hygienist. Thank you all.